include kind of some of our solutions to the women's health conundrums that we brought up yesterday, for those of us born with a uterus and ovaries. Okay. So, of course, these statements have not been evaluated by the FDA, as are hardly any product statements on any supplements. So preconception health, people often think of preconception health as just the woman's health before she becomes pregnant. But the fact is you have two parents, a male and a female parent, and you can actually have mutations and other things go wrong in the DNA of the male parent too, if they're not watching their health or they're exposed to things that cause DNA mutations like radiation, pesticides, herbicides, etc. So the health of both individuals play a role in the neurologic, metabolic health of pregnancy and the healthy development of the fetus. Both food and diet, lifestyle habits, and supplementation count. Of course, they are somewhat more important in the mother, but they can be important in both if you have a germline mutation that comes from a father. All these factors have an impact on preconception health and the fertility of both individuals. So men's fertility can be just as affected in what's going on today with xenoestrogens, all the plastics in our environment, all the toxins in our environment. And in fact, fertility rates for both men and women are declining. Concerns related to lifestyle health and hormonal support, nutritional misconceptions, environmental exposures, stress, lack of sleep, and weight, both over and under. So a lot of people, of course, blame a lot of things on overweight, and that is the main thing in our society, of course, estrogen dominance from extra fat and, estrogens being made in fat, etc., converted from testosterone via aromatase. However, underweight can also be an issue too. It can cause something called hypothalamic amenorrhea. So a lot of women that are super active, super thin, actually, sometimes they even get misdiagnosed as having PCOS, but they don't have PCOS. They just don't have enough fat to make estrogen. So it's a balance, between that. So contributors to hormonal well-being, nutritional status, environmental exposures, pesticides, things like glyphosates that have xenoestrogenic properties are abundant in non-organic food. Exogenous estrogens, like we were talking about, heavy metals actually. Heavy metals can actually stop the conversion of T4 to T3, which is the active form of thyroid, and we know how that impacts female health. We talked about that quite a lot yesterday. So can exogenous estrogens or xenoestrogens. They can actually affect thyroid function, and the thyroid function has a lot to do with fertility and cycles. And so, these are things in our environment that are really a huge problem. Body composition, as we talked about, stress and sleep hygiene both contribute to this. And we talked about how cortisol can be dysregulated with sleep and stress and actually, rob you of the hormones you need, like the progesterone you need to maintain a pregnancy. So preconception support studies have demonstrated the need for more comprehensive micronutrient support for women compared to just folic acid alone. Vitamin D3 is important to healthy fetal development. Magnesium, essential fatty acids, especially omega-3 fatty acids, especially DHA, have been shown to be really important in fetal brain development. Something I wish I had known about, when I had little kids. I never had any clue about that, 25 years ago. Alpha lipoic acid, 5-methyl tetrahydrofolate. Of course, you want to have the right form of folate because for the 25 to 60% of people that have some issue with methylation, they're going to have more trouble with conception, more trouble with maintaining a pregnancy, more trouble with detoxification, more trouble with making and clearing hormones if they have those methylation issues. Vitamin B6 as P5P, there's actually a segment of the population that cannot convert B6 to P5P, and they can get a backlog of the non-P5P type of B6 that can actually cause a neuropathy. So if you're using P5P, you're actually circumventing that. A lot of people think about methylated Bs. They don't think about P5P and B6, and that's actually the kind of B6 and the only kind of B6 that you want in your supplementation. Vitamin E and antioxidants are all really important to a healthy pregnancy and a healthy preconception mom. We're going to talk about, the length of time actually that you need to think about this. But for me, I actually started talking to my teenagers about this because really some of the data shows that with folic acid, I think one of our slides says a year, but some of the data says 4 years is actually what it takes. 4 years of adequate folic acid to really protect you against neural tube defects. So it's a really, really important thing. Prenatal vitamins consist of a variety of vitamins and minerals specifically designed for women who are trying to get pregnant or who are pregnant. Prenatal vitamins are designed to meet the increased requirements for certain nutrients needed during pregnancy that are vital for proper fetal growth, development, and healthy adult living. And I actually keep a lot of women of reproductive age, whether or not they're pregnant or thinking about becoming pregnant, on the prenatals because of the really good things that they have for women's health in general, which I'm going to talk about. So it's challenging in making supplements more acceptable, basically. It's pretty hard to tolerate vitamins when you're pregnant. I know that in my day, I never took my vitamins, my prenatal vitamins, because they just made me more ill than I already was. I would have given anything to have something like this prenatal product that's here. So it doesn't smell or taste like a vitamin. Really kind of tastes more like an orange juice or lemonade. Easy to swallow, does not irritate the stomach, and passes through it quickly and efficiently absorbed, therefore reducing the possibility of reflux, nausea, or loss of nutrients if regurgitated. I really have not had any of my moms ever complain about this. And, you know, iron is really very hard to tolerate in normal prenatals. Nobody ever talks about that with this particular vitamin because of the type of iron. Can do all of the above and provide for the needs of a pregnant woman. So the Isotonics Prenatal Activated Multivitamin, I would have really kissed the feet of any doctor that would have given this to me when I was pregnant, really, believe me. Especially because, you know, it has zinc. Many of you know that I have a kid on the autism spectrum. There's a lot of data with zinc being very, very important in neural development, you know, preconception, and I was getting really zero of it. One thing that this particular multi has is really an adequate amount of zinc, which is actually rare. A lot of the prenatal multis don't actually have a regulated amount of zinc, and they don't have any studies showing that they achieve good blood levels of zinc. It provides vitamins and minerals essential for normal growth and development of the baby, helps maintain normal blood pressure during pregnancy, especially, you know, magnesium is very important with normal blood pressure during pregnancy. This contains magnesium. Healthful diets contain adequate folate, may reduce a woman's risk of having a child with a brain or spinal cord defect. Of course, it's too late once you're pregnant to prevent that. So it's something that you want to be taking, you know, in the years prior to becoming pregnant. So if you know of young women, this is really the time to get them started on this, get their habit going. Helps promote a healthy birth weight of the baby. Deficiencies of micronutrients are the causes of low birth weight, and pregnancy increases the requirement for certain vitamins and minerals during pregnancy. So what ingredients make this supplement very beneficial to women? So quatrefolate, which is metabolically active methylated folate, is used for cell division, growth, neurotransmitter formation, energy, and detox. So you don't have to worry about whether this person has been genetically tested to see if they have MTHFR or MTRR. The B vitamins in there are activated and ready to go. Sun Active FE provides a non-irritating iron supplement. And again, this is really very rare. It's rare to have an iron supplement that does not irritate people's stomach. This is it. It's an iron that actually comes from algae. It's very well coated in a sugar matrix, and it is very, very easy to absorb, does not cause constipation. It's really amazing. And then magnesium glycinate, which is a really amazing magnesium as far as the way that it absorbs, the way that it does not cause diarrhea, but keeps normal bowel function, really helps with anxiety, with nerve type issues. Really helps support the muscles because, you know, when you're pregnant, I mean, your body, you're walking so strangely and you tend to get a lot of muscle spasms. Magnesium really helps with maintaining good muscle health, healthy bones, teeth, joints, and skin. So it's time for metabolic and nutrition support. And I would say the one thing that's not on this slide is zinc. Zinc is also a really big component of this vitamin in a very absorbable form, in a form that actually has studies showing it gets into the blood. So really, really an amazing thing. So begin taking prenatal vitamins 3 months to 1 year before you conceive. I would say probably 4 years before you conceive at least. Get at least 1,000 milligrams of calcium a day in beans and green veggies because those little babies are going to suck that right out of your teeth and bones. So you want to have the adequate amount. Avoid caffeine, including chocolate. Research has shown greater than 300 milligrams of caffeine may reduce fertility by 27%. Also, caffeine has been shown to cause chromosomal breaks. You know, for me, it was really the hardest thing to avoid during pregnancy because I drink tea as an infusion all day long. Glad to be postmenopause now, so I can do what I want. Avoid artificial sweeteners, alcohol, recreational drugs, cigarettes, since they have potential to harm the baby. Okay, so achieving balance. Reaching balance requires a mixture of vitamins, antioxidants, powerful minerals, and the right combination. A woman's body has unique needs based on her age, her weight, and her physical fitness. A woman wants to look great and feel good. And like Dr. Deidre was saying, I mean, there's a lot you can do to do that. You know, honestly, right now at 52, I feel, look, and in better shape than I was through most of my 20s and 30s. I really credit that to lifestyle and the things that I have done to really, you know, take that science of anti-aging to heart. So that's really what I want women to know, and men to know, really, that it's not over. You know, just because these biological clocks are ticking does not mean you cannot do things to really help yourself and stop them. So antioxidants, minerals, you know, whether it's preconception, pregnancy, or breastfeeding, whether it's, you know, those of us who are in the, you know, middle ages of our lives, it's all very important. Whether it's premenstrual symptoms or menopause and sleep, and of course, so many things affect PMS, like B6 is so important in estrogen metabolism. So many women aren't getting that P5P form of B6.
So I think
this Women's Health Isotonics Essentials actually has a lot of what women need in one little packet, which is really easy to take. Quadrafolic, the Sun Active Iron, the pycnogenol, which is so important for skin, for good joint health, for cardiovascular health. Yesterday we were talking about the number one killer of women is what? Cardiovascular disease, right? Followed by cancer. So, you know, if you have something that really is protective of the cardiovascular system, is really decreasing inflammation, really helping your immune system to be on the alert for the wrong things, but actually helping your immune system to not go overboard, something like pycnogenol, along with your, you know, normal vitamin that you're taking, that's really amazing. This has no soy, no yeast, no artificial flavors or preservatives, really no junk in it. It's purely something that gets absorbed, goes right into your body. You know, they say that like when you, with pills, I mean, you're only getting maybe 40% of what's in a pill. With a capsule, you're getting about 60%. Here, you're getting 95%. And so when people talk about expensive, we'll talk about, you know, expensive urine, really, is what they're getting with what they're spending their money on elsewhere. Iron, Sun Active FP. Iron is essential nutrients often lacking in diet, especially for infants, women of childbearing age, pregnant women, and the aging population, including men. A lot of people don't know that iron deficiency can really affect mood, can make you really irritable. It's really a big thing that goes on for women that I see of reproductive age who are still menstruating. And then a lot of people, as they get older, they just don't consume enough iron in their diet. So a non-reactive iron compound such as ferric pyrophosphate or Sun Active Fe has less of an iron taste, really no iron taste at all that I detect. Sustained release, so you can use it more properly and take it in a little bit at a time, because of course absorption is a big thing with iron. It's gentle on the gastrointestinal tract compared to soluble iron. It's highly bioavailable, and it has decreased precipitation. And of course, in this formula, it's also with vitamin C, which there's some studies showing that iron and vitamin C absorb well together. Quadrafolic is the glucosamine salt of 5-methyl tetrahydrofolate. It's structurally analogous to the reduced and active form of folic acid. So it's really folate, not folic acid, which is the natural form of the vitamin B, and the quadrafolic actually has a methylated form of that natural folate. So it's in a form that your body can immediately use. It does not have to go through methylation steps. So if you're a methylation challenged person, it's not going to cause you problems. Pycnogenol, a large body of research exists that substantiates pycnogenol's multiple benefits for women's health. There's actually some data with people who have estrogen challenges that I invite people to look into. Healthy aging, healthy skin, vascular support, joint health, cognitive health, the link between hormonal shifts in aging and cardiovascular health. What I would say here also is reproductive health. There's data with pycnogenol with normal menstruation, normalizing menstruation, normalizing you know, the comfort of menstruation, really, in a very big way at a dose of about 75 milligrams. So look into that, because I think it's really a profound effect with pycnogenol in women. I was very thrilled to be introduced to this supplement. I was already in my 30s at the time. I wish it had been earlier. But I think, you know, for me, it's made such a profound effect in the person that I am. So for your consideration, besides progesterone, stress-related hormones, adrenaline, and cortisol, both with a direct and indirect effect on prostaglandins, the chemicals that lead to constriction of blood vessels, and then concentrations in the muscle and uterus. So basically, adrenaline and cortisol also drive whether, for instance, you have cramps during your period, and also they have effects on your prostaglandin release. Prostaglandins are those inflammatory modulators in the thromboxane pathway. Remember we talked about omega-6s, which actually cause a lot of the contractions and discomfort that happens during periods. So exercise increases blood flow and endorphin productions, which can affect the amount of prostaglandins and menstruation concerns that one experiences. In other words, exercise is really, really helpful in this. So is controlling cortisol and epinephrine and norepinephrine, especially if you have a challenge like you have a COMT mutation or something like that, where you're not really getting rid of cortisol and adrenaline and it's really pumping up your prostaglandins. Then it's really helpful to have exercise, to have mind-body wellness practices that can really do that. Prostaglandins are a big thing when it comes to menstrual pain. And so getting control of them is super, super important. Exercise is one way, there's some other ways. So prime feminine is actually, for those of us in the midlife plus, it has a lot of things to support healthy aging, healthy hormonal health. So menopause symptoms and management, 40% of women seek out medical advice for the management of symptoms, including hot flashes, vaginal dryness, night sweats, and sleep disorders. And in fact, some women just have sleep disorders as their progesterone falls without night sweats, but of course if you're sweating all night, that's extra plus, terrible. NCCAM has 5 categories of management. That's the National Association for Menopause. So there's biologically based, so botanicals, minerals, vitamins, and amino acids, mind-body practices, spiritual, behavioral, social, things like Tai Chi, things like tapping or emotional freedom technique that I spoke about yesterday, energy therapies like therapeutic touch, magnets, sound. I would say Reiki would probably go into this category. Manipulative therapies like chiropractic massage, and whole medical systems like TCM and Ayurvedic medicine as ways of treating and managing menopause. Prime feminine is in that botanical category. It helps to reduce hot flashes and night sweats associated with menopause. It helps alleviate mild symptoms commonly associated with menopause. It helps stabilize mood. We talked a lot about cortisol, DHEA yesterday, and how that can affect your mood at menopause's DHEA levels and your ability to make DHEA fall, and your cortisol goes up and it kind of causes irritability. So it has some things for that. May help maintain normal hormone balance, may counteract mild effects of PMS, and helps obtain optimal female health. And here's what's in it. So Dong Quai, which is also called Angelica, if you're aware of traditional Chinese medicine in the name of herbs, soy isoflavone, wild yam extract, which has long been used. It's actually used by the Aztecs as a therapy for female conditions and hormonal health, and actually is a kind of an analog of progesterone in some ways. Black cohosh, chasteberry fruit extract, horsetail, red clover, valerian root, passion flower, tribulus, and B vitamins are all in this. And the tribulus is really interesting because it has a really profound effect on libido, which is one of the most common complaints that we get. So a closer look at some of the leading actors. Black cohosh was used as a remedy for hot flashes associated with menopause and PMS. It's really kind of a vascular stabilizer more than anything hormonal. It contains tryptophan glycosides, isoflavones, alkaloids, phenolic acid, and phytoestrogen, some phytoestrogenic activity. Low estrogen levels are linked with symptoms associated with menopause, and black cohosh may alleviate mild symptoms of this. Black cohosh was traditionally used to provide relief from menstrual cramps. Also, studies show it reduces the number of hot flashes, improve quality of life in menopausal women, decreases in total menopause discomfort, and a decrease in night sweats. The interesting thing about black cohosh is it's one of those supplements that kind of blew wide open the supplement industry in general. So that's why you really want to go with a company that has someone like Dr. Lane. No, because he really is an amazing quality control expert, and he really pays attention to what's going on. And that's
So it's as good
rare,
as
you know,
you might as
and
well
one
go
thing
through
I
it.
tell my patients is my duty as a doctor. I mean, everyone
Then I will
signs
just
something when they
execute
come into my practice that says you're free to go anywhere to buy
as and
supplements,
when
just make sure they're third-party
you feel
tested. And for me, if I put something on my shelf, I have to know the quality control person at
yeah,
that company,
so
or I'm not putting it on my shelf. It has to be a company that can sell in Australia, or I'm not putting it on my shelf because Australia has extremely stringent standards as far as what goes into their country. Their
if
country
I want
actually batch tests
if I want
supplements.
to close one eye
So,
and I just want
you
to
know,
bring
this is
somebody
where
can lah.
there's an OBGYN who actually started to see
But
his
if,
patients who
if
are
the
on black
I mean,
cohosh get liver failure.
I
And
have
he's
a
like,
few
well,
like
that's
the one
weird.
who
You're not
used to go
supposed
at
to get liver failure
G99. I
on
mean,
black
not the
cohosh.
best.
So he
Right,
actually
and
got a grant from the NIH. He pulled 10 different black cohosh supplements off the shelves of a health food store and sent them in to get tested. Well, only 2 of the supplements actually contained black cohosh in the dose that was there. One of them was Remifemin, which is like a, you know, name brand from Germany, and the other one was one other third-party tested brand. And everything else either didn't have the amount it said, or it had some herb that's actually a liver damaging herb that looks like black cohosh. So really, there's a lot of bad out there in the supplement industry. As a physician, I really feel like my job is to protect my patients from the bad and to really deal with really quality supplements. And so when you're giving patients supplements that come from a company that's very, very fastidious about third-party testing, you're really doing a protection and a favor for that person. So don't forget that, because it's really important. And black cohosh is one of those things that really demonstrates that. Dong Quai is often referred to as the female ginseng because of its supportive benefits during menstruation. It contains coumarin, which kind of mildly thin the blood, ferulic acid, ligustolide, which aids in promoting normal blood flow and muscle relaxation. Most common uses with mild cramps and discomfort during menstruation. You know, you kind of think of it as maybe thinning out the clots a little bit, as well as to alleviate some of the mild symptoms of menopause. Dong Quai does not have hormonal effects on the body, but rather supports normal blood flow for tissues to be responsive. Chasteberry extract, shrub native to the Mediterranean, you know, my place of origin in Central Asia, used in dietary supplements for helping to maintain normal levels of female hormones, particularly estrogens. Mild menopausal concerns have several active ingredients, including diterpenes, flavonoids, which of course we know are really powerful antioxidants that come from plants, essential oils, and glycosides. Chasteberry also appears to be selective bind beta estrogen receptors, helping to alleviate mild symptoms of menopause. And of course, beta receptors are the ones that you want to bind to because they're the ones that do not stimulate cancer. And so this is a great way of helping botanically with menopausal symptoms without causing estrogen excess by prescribing estrogen. Chasteberry is often looked into for supporting uterine muscle, helping with mild symptoms of PMS, promoting mood and well-being, breast health, and comfort. Wild yam we talked about is historically used for mild symptoms with menstruation, menopause, including cramping, hot flashes, and occasional fatigue. Like I was saying, the Aztecs used it, they knew what was in it pretty much. Wild yam saponins are commonly thought of as a hormone precursor in the body's normal manufacturing of progesterone. Saponins are linked to promoting healthy cholesterol levels by promoting normal levels of triglycerides and supporting healthy levels of HDL cholesterol. Again, here it's important to get the right kind of wild yam, so having a company that tests for the source, tests what's in there is really, really important. Soy isoflavones, phytoestrogens, are non-steroidal compounds that possess estrogen-like biological activity and come from plants. Again, soy binds to the beta receptor, so there's a lot of misconceptions in there about soy causing breast cancer. It does not. Used in dietary supplements for helping mild menopausal concerns. What I noticed with soy is really a great boon to my body composition, really great help for my skin and, you know, the reduction of wrinkles. You know, at 52, I mean, I've had no plastic surgery, don't want any. Soy isoflavones are one of those things that really can help to really, you know, bring your skin to where it needs to be if you don't have a soy sensitivity. Now, it is one of the top 5 allergens, so that is one thing you have to think about. Soy isoflavones have weak estrogenic and anti-estrogenic effects, so that's why soy is so good, because it actually acts as an anti-estrogen, for instance, in the uterus. Helping to balance mild symptoms of menopause, may be linked to promoting bone health and female well-being. Active constituents include glycones, genistein, diazine, and glycine. And of those, genistein actually has the most studies as, you know, a promoter of health in women. Tribulus terrestris is traditionally used in Ayurvedic medicine. Used to promote optimal blood circulation. Of course, we all know that for arousal, you need good blood circulation to those parts. Active constituents are saponins. Research suggests it may help maintain hormonal balance and help maintain normal sexual function. Valerian root, used in dietary supplements for helping mild symptoms associated with sleep in premenstrual and menopausal women, helps reduce mild PMS symptoms, difficult sleep, mood or emotional sensitivity. Clinical trials have shown the extracts of the root promote sleep, which stem from the herb's tendency to boost levels of gamma aminobutyric acid. The clinical messenger in the brain. GABA is actually a calming neurotransmitter. It balances glutamate, which is an excitatory neurotransmitter. And so GABA levels are really important for sleep, really important for relaxation. A lot of us don't get enough taurine and the other precursors of GABA in our diet, and so it's really a helpful thing. So less stress, more sex. What helps you maintain sexual interest and desire? Less stress. Definitely, if you're under stress, that can decrease it. Health status. If you're tired, if you're ill, it's very hard to be sexually engaged. Adequate sleep and emotional security. And I think, it's really important to start to normalize the conversation around this, because so many people really suffer in silence when it comes to this, and it's very important. So gender differences. Concerns vary between men and women. Men are more concerned with stamina and erectile dysfunction, which of course have a lot to do with their cardiovascular health and their endurance in general, the general state of health. Women are more concerned with desire, interest. Sex has an impact on stress. Stress has an impact on sex hormones, as we were talking about before. Cortisol, when you're under stress, undue stress, chronic stress can steal away those precursors for progesterone and testosterone, which women need and men need for a healthy sexual life. 52% of adults, both men and women, report being dissatisfied with their sex life. That's a very high number. And I actually think it might be higher because a lot of people don't report it. Being sexually inactive is a choice for some individuals, but it can be a source of stress for others because, of course, it helps a lot with pelvic health, with stress relief, etc. Sex drive is determined by biological levels of hormones, environment, so your occupation, toxins, diet, psychologically, internal psychological factors, self-image, personality, and stress and confidence, social factors, work and family, lifestyle, relationship issues. Stress has an impact on sex hormones and their precursors. Lack of sleep is common among stressed individuals and has a high impact on sexual health. Of course, if you're tired, you're probably just going to want to go to sleep. Too much oxidative stress, poor diet, and lack of physical fitness are all things that deplete our sexual interest and are very important to look at. Because if you're healthy, then sexual health comes with that. So this is the isotonic sexual health formula. It contains Tribulus terrestris, which helps reduce stress and improve libido in both women and men. Fenugreek, which contains natural precursors to estrogen and testosterone. I think of fenugreek, in the context of like mother's milk tea, but here it is. Pycnogenol boosts nitric oxide for better blood flow and circulation, very important for circulatory health, super important, especially in men, but also in women when it comes to blood flow to those areas, which really piques interest and all of that. And then ginseng also increases nitric oxide, improves erectile and sexual function. Tribulus terrestris is a general tonic for energy. Root and fruits are used for general vitality. The roots are known to support libido and sexual well-being. Research shows that taking Tribulus seems to support sexual experiences in women with low sexual desire and may promote overall satisfaction, desire, sexual arousal, and sexual health. Fenugreek supports sexual drive, arousal, and libido in both men and women. Studies have shown that fenugreek may show promise for supporting sexual function. In women, fenugreek supports sexual drive and function.
I did tell it to Jenny.
Pycnogenol promotes normal vasodilation, smooth muscle contraction in the body and in the genital muscles. It promotes normal nitric oxide synthesis, which is important for normal blood flow in parts of the body. Of course, it has those awesome effects on also joint comfort and all of that, which is really important when you're trying to do certain things. All around, the nitric oxide part, the good blood flow part is really, really important for both men and women. Red Korean ginseng is a standardized red ginseng or Panax ginseng. It gives you a sense of calm, focus, support, energy, mental clarity, and concentration. Ginseng is an adaptogen, has a wide variety of health-supporting properties. Adaptogen meaning it supports adrenal function and dealing with stress. It promotes normal nitric oxide synthesis, assists in normal dilatation of blood vessels. By acting as an adaptogen, it supports the body in directly dealing with the effects of mental and physical stress and promotes physical, including sexual and mental performance. So again, this is something that really helps deal with stress, helps bring up performance, and so it can do that in many areas of life, but also sexually. The goal of any sexual health formula like isotonics sexual health is to promote sexual arousal and intensity, to support blood flow and sexual drive, again, these physical things, maintain sexual activity and interest, contain precursors to estrogen and testosterone, may be consumed daily as a dietary supplement. A healthy libido is an important part of an intimate relationship. A lot of times, of course, one partner may have challenges and they don't even know that they have health challenges leading to low libido, and it kind of becomes offensive to the other partner who just thinks that they're maybe undesirable, and it's really the health of the partner that's at issue. And so this kind of helps address some of those things. So for her, it helps desire, arousal, sexual interest, and libido. And for him, his drive, his sexual function, in erections, desire, and blood flow. So here are some other things to consider which really help sexual health. Curcumin really for its properties in joint comfort and basically hormone metabolism, getting rid of extra bad estrogens both in men and women, because there's research that it can help with normalizing estrogen levels through the liver. Essential omegas because they help with comfort, they help with blood flow, they help with normalizing joints with basically the proper production of dopamine, which is needed for desire. Isotonics, vitamin D with K2 to keep a person, keep a person's immune system healthy and going. Also for joints, also for adrenal function, as we talked about. Advanced B complex, really important in stress management and adrenal function. Magnesium, helpful to keep muscles supple and pelvic comfort, and then the collagen actually for attractiveness, looking youthful, and all of that. So that's it as far as what I have to say about female support. It's been a pleasure being with you.